She went to urgent care. She went to her doctor. She went to the emergency room multiple times, 6 times. And the
Yeah.
baby went home and died in her room.
Mm.
Early 20s. She had all kinds of signs that even as a nurse, just hearing these things, swelling in her legs, shortness of breath. She's in her 20s. So
Mm-hmm.
nobody takes the time to check on this patient or check on this person and go beyond what you the average things are. We're not doing that because one, the system is also overwhelmed. So as a nurse working with patients, you're talking about, like, I've worked as a CNA before I became a nurse in a nursing home, and I got a whole hallway full of patients. How are you able to properly care for all these people? When I
Mm.
worked in the ICU, I would have, maybe two to three, two critically ill patients and maybe one that's more stable. How are you really able to take care of all these patients? And what happens is you end up taking care of the patient that either is the sickest or has the most demanding family members, and everybody else is not treated. When you work on the floor, like say a medical surgical floor, you have multiple patients that you have to do labs, and if they don't have that in their hospital, you have to give medication. The system also is not set up for you to sit down and say, "Hey, what's really going on?" And on top of that, when people push back in terms of patients, when patients push back, like I would have patients that would say, "Hey, I don't take that medication." Most people are going to ignore them. You say that a couple of times, and I'm going to say, wait a minute. They say you take it. They're like, no, I don't take this medication. And when you stop and take a second and listen to them, you
Mm.
realize that you just prevented an error,
Mm.
something that could have critically happened to this patient. But we are nurses also, we're underrepresented. We are
Mm.
extremely overworked. It's also a systemic thing too. So it's just all the way around. So we talk about overcare, but there's also a lot of undercare that happens in healthcare too, that causes a lot of deaths for people.
Yeah, and I love what you just said about, I mean, you said so many great things. Thank you for sure. That was insightful. Just thinking about like the idea of somebody coming in extreme pain. I've been in extreme pain going into a hospital before, and you're right. It's like you're screaming and yelling because you just have a thorn in your side that you want somebody to take out. So you're not going to come in and be like, "Hi, I'm Tiara, and I got this thorn in my side." You're gonna be like, "Oh my God, get it out!" There, it's gonna be a different you.
But you're dramatic. They're going to
It's
call you dramatic, or either you're drug seeking and they're going to label you as opposed to really hearing you out. And I think part of it, for me, that I dislike about healthcare is the fact that it's not healthcare. It's about the numbers, it's about making money. Most people don't care. And I'm not talking about people like the nurses, right? We're talking about leadership. They care about the bottom line, they don't care about the person. They don't care about healthcare. In other countries that have free healthcare, a lot of these diseases that we have, they don't have. Why? Because they regulate things differently. They're not going to allow certain things in foods that's going to create certain illnesses because their healthcare is free. But because we can bill, and I'm sure you all have been to the hospital. You go to the hospital and you get your bill and they charge you for every single thing.